चालू का
ये ऑप्शन नहीं
ये ना
बस
नीचे का वो ट्रांसफर हो गया इसके ऊपर आप क्लिक करो ना तो अपने पास तो आपने स्टॉप किया यहाँ से स्टॉप का मतलब नीचे स्टॉप किया था
मल्टीपल
Hello everyone. So today's topic is watery eyes. Watery eyes in medical term it is known as epiphora. Now this condition, whenever the patient comes to you and if their symptom is watering of their eyes, maybe one eye or maybe both eyes. Before talking about watering, we should know this water comes from where. Here you can see in the eye, this is a lacrimal gland. From this, there is a lacrimal secretion, that means tear film secretion. And this whole tear film comes through the lids where there are ducts, and then the whole lacrimal secretion, that is a tear film. And then there is a conduction of the tear film to the punctum and canalicular. And here you can see the sac, lacrimal sac, which goes into the nasolacrimal duct, which opens into the nose. So this is the way there is a secretion and there is a conduction. So there has to be a balance of secretion and conduction. And in that condition, there is no watering. But in certain condition, where there is a watering, and if there is a block in the conduction, so whatever secretion is there cannot go through the canalicular, so whole water comes out. So this is a epiphora. So whatever I said here, you can see in the diagram where there is a tear gland, there's a lacrimal gland through that lacrimal secretion and goes into the canalicular and goes into the nasolacrimal duct into the nose. So whenever there is a block here, that means nasolacrimal duct obstruction can lead to this epiphora. But remember, in this condition, the eye is normal. There is no redness, there is no congestion, or any other symptom. Only there is a watering. The eye as such is normal. That means normal means there is no redness or any other symptom also. More of a watery, and at the most there is a discharge. Maybe little whitish if there is an infection. Otherwise it's a clear water. So this is regarding your nasolacrimal duct obstruction, which can lead to epiphora. Now, before we talk about watering, of course, there are many other causes also of watering. Very important cause, which I have told you, is about the nasolacrimal duct obstruction. that you can see that the eye condition is normal, there is no redness. But there are other conditions which can lead to watering and other symptoms also, like redness or itching or discharge. So first, very important, you are supposed to ask is history of injury. If there is an injury, you will see all other surrounding structures also. There may be little uh, blood under the skin, ecchymosis, that known as ecchymosis, or you can make out some swelling around. So there is a history also, which will tell you that this is because of that. In other condition known as eye strain, where there is a refractive error because of the number, there's an eye strain and there's a watering. It's more of a, whenever you do more work, more near work or more distant work can lead to watering. One more condition known as allergy. In this condition, there is a allergy to dust particles or any spores, vegetarian spores can lead to allergy. In this, very important symptom is there's a itching. There's a redness and there's a itching, which will tell you that this is allergy. And usually, it's more of a clear water. Only if there's infection, the whitish discharge will be there. One more condition known as eye infection, most common is conjunctivitis, where you will see whole conjunctiva, whole scleral area where there's a conjunctiva, there will be congestion, there will be watery, there will be lid edema, there will be discharge. So this is regarding conjunctivitis. And another condition, where there is a corneal infection also can lead to watery. Suppose corneal abrasion is there, corneal ulcer, maybe bacterial, viral. And nowadays, most common dry eyes. Now, in this condition, you will say, why dry eyes? You are saying dry eyes, but there is the watery. Yes. In dry eye condition, there is a lacrimal secretion, but the oily part is reduced. And because of that, there is a irritation in the eye and there is a lacrimal secretion and watery of the eyes. It's the most common condition. Those who work on the computer or especially in old age or in diabetic or autoimmune disorders, the dry eye condition occurs. So all the conditions, whatever I have told, remember this, all this condition like infection, allergy, injury, eye strain, dry eyes. And first what I told you about the nasolacrimal duct obstruction. So according to the cause and symptoms, the treatment is given. If there is obstruction, you can clear it off with a probing, or if surgery, if it is of a longer duration, that you can do. And other condition also, whatever treatment is given, you should start. But I think if it remains for a longer time, or if you want to reduce certain drops like steroid eye drops or oral steroid or oral antibiotic, along with that homeopathy you should start, and then slowly allopathy reduce, and you can continue with the homeopathy. Really gives good result. I have seen many patients having really good results with homeopathy. Thank you very much.
So hello and namaste. I hope you can all hear me and see me. And Dr. Pushpa has already spoken about watery eyes and how the homeopathic approach is in ophthalmic cases, typically when there is watery eyes. I want to just talk to you about the homeopathic approach here. In homeopathy, and we have spoken about this before, the idea is individualization. The idea is case taking in depth. The idea is going in depth, taking all the peculiar symptoms, understanding the patterns, understanding the past history, family history, the soil of the person, and then prescribing the remedy. However, it's also important for us to know the diagnosis, because if the watering of the eyes is, let's say, due to conjunctivitis, the prescription of the remedy will be slightly different to, let's say, if the lacrimation is due to, let's say, something to do with the lacrimal duct fistula or some other kind of disease, or a more deeper retinal or macular disease. So for us to know the diagnosis would be very important. I want to quickly tell you some clinical tips that I use. If something goes into the eye and after that there is watering of eyes, one remedy I want you to remember: aconite. Aconite 206 hourly. That's the first thing I want to tell you. Foreign body in the eye, every repertory says aconite. That's one remedy I want to tell you. The second remedy is due to the dryness of the eyes, when there is too much of watering. Okay. The big remedy is ruta. If there is stringy discharge, it is crocus sativus. Sometimes after cataract surgery, there is watering of eyes. Think about Seneca. Sometimes, due to pain somewhere else, there is watering of eyes. Pain in other parts of the body causing watering of eyes. Natrum muriaticum. Another remedy, cinnabaris. And finally, one more peculiar thing. If while eating, patient says, whenever I'm eating food, there is watering of eyes, think about oleum animale. Another remedy. So in this way, there are many remedies. The idea in homeopathy is to understand deeper patterns and prescribe based on individualization. And here in Mumbai, we have a integrated homeopathic clinic where we have homeopathy along with an ophthalmologist, my mother who sits with me, and our nutrition team. We work together in a holistic way to heal our patients. So this is a very special place. Very important. I want to talk to you about is lifestyle, what we eat, what we drink, how we sleep, what movement we do. All this works together with homeopathy. Take benefits of homeopathy and integrated holistic treatment. You want our consultation, you can write to us on the email ID below, gaurang@gmail.com, or you can either come and meet us here in Mumbai in our clinic, or we can also do an online consult. So take benefits of it. Thank you and namaste. Bye for now.